name is Yumeka Rushing. It is my distinct pleasure to serve on the board of the Children's Foundation of Mississippi and as your host for today's Chat About Children. This is the first chat of 2021, and we'll be talking about Mississippi's Risk and Reach Report, a first ever report of its kind. Today, we have Ben Walker. Ben is a researcher at Mississippi State University's Social Science Research Center, who led the research team on compiling this report, and Linda Southward, Executive Director of the Children's Foundation of Mississippi, to talk with us more about this report. Let's start with Linda and talk about the reason for having a Risk and Reach report and why this is important.
Well, thanks, Yumeka, and thank you for not only being host, but being a stellar board member of the Children's Foundation and having so much of the vision of it to begin with. So when we think about the Children's Foundation, we certainly believe that for Mississippi to reach its potential, Mississippi's children must reach their potential. And so we want to make sure that children get off to a strong start. We're really setting the stage for our communities to realize new possibilities. And so with that being said, we see the Risk and Reach report as a tool, really as an important piece of information to inform the state of where we are, but even more important, where we want to be and where we want our state's children to be. So the idea of Mississippi having its own Risk and Reach report began many months before the onset of COVID-19. And for the most part, it depicts data before the onset of the pandemic. But it's important to note that because the pandemic has certainly reinforced the important recognition of the interdependence among individuals, families, and communities, we need to work together. So it really, in a sense, we think about the Risk and Reach report as like a GPS, giving a sense of the lay of the land across our state, highlighting some of the complex spots where there is rough terrain, if you will, to be navigated. So using the data in this report, we can chart routes from where we are as a state from where we want to be.
A GPS, that's a great way to describe it, Linda. Ben, I have a question for you. Given that this report is something new for Mississippi and different than previous Mississippi Kids Count reports, walk us through the process of compiling the report. What did you mean by risk indicators, reach indicators, and how were these chosen?
Sure. Probably what I should do first is start by describing the previous fact books for people who may be less familiar with Kids Count or the reports that we've done. So typically, as a part of the Annie Casey Foundation, as a subgrantee on that project, each state has the option of putting out a fact book each year. And so we would compile a data book that would have indicators across the 4 Kids Count domains, which are health, education, economics, and family and community. And so we would have a collection of data in these reports. We would produce maps and infographics and sort of visualizations. And typically, some of these indicators were issues that threaten child well-being, like low birth weight or poverty. So we might call those risk factors for now. And other indicators that were more about different resources that we like, to track as a state. So something like pre-K participation. And so, we were inspired by the work that several other states have done. So we weren't the first state, it's the first kind of report like this in Mississippi, but other states had done similar reports, and we really liked the way that they sort of made the connection between these two types of information. So on one hand, you have the things that we're really worried about with children and families, and then you have the sort of resources and programs that can help them. And so we sort of wanted to take the next step and sort of overlay these two things and look at, okay, so on the one hand, we have these sort of risk factors spread out across the state. We wanted to look at how our resources to address these issues distributed and kind of help us look at, do those things line up? Is the reach of Mississippi's resources effectively set up to address and reduce these risks. So I think part of your question was asking about what are risk factors and reach factors. So in the report, we define them at the risk factors. These things tell us how families and children are doing in each county. And so and then the reach factors tell us about the availability and distribution of, again, the programs and resources for families and children. And I believe you had also asked about how we chose these. So again, we weren't reinventing the wheel. So we had, these great reports done by other states. And so a few of them were Louisiana, Illinois, and Colorado, I think. And so we were able to look at some of the indicators that they had chosen, and some of them were just sort of low-hanging fruit. So things like infant mortality and something like a program like pre-K. And so we use those as a resource to start, and we started with a really large list and sort of called it down. And we also drew on our collective expertise at SSRC and the Children's Foundation. And so I can think of also our board. So I can think of at least one reach factor that was recommended by an advisory board member. And just one more thing about choosing indicators, we inevitably probably left something off. So it by no means would I say that it is a definitive list of all the things that we should care about regarding risk factors, or maybe more importantly, it doesn't have all the programs and sort of resources that Mississippi children need. It's sort of what we sort of did our best job to sort of get it down to a reasonable number of different risk and reach factors.
Thank you for that, Ben. For each of you, what are some of the most striking findings in this report? Linda, let's start with you.
Sure. So as Ben said, there were 16 indicators. And when we look at the counties that have the highest risk, 11% of Mississippi's children live in high-risk counties. Another 25%, 26% live in the moderate to high-risk counties, 37% in the low to moderate risk, and 25% in low-risk counties. So in other words, 75% of our children are living in non-low risk counties. And that's a concern all across the board. And so when one looks at reach indicators and understanding that, as we know, approximately 100 babies are born each day in Mississippi, I think this report can help sharpen our lens and sharpen our focus on the importance of the reach of services and the programs that can help diminish some of the risk factors. I think it's also, when we think about, these are areas that are just basic needs in many areas. One example is that a program like home visiting that's evidence-based and funded federally, the Healthy Families Mississippi program, are known as the MCV, Maternal Infant and Early Childhood Initiative program. That's an evidence-based program. Yet this program is only operating in 14 of Mississippi's 82 counties. So that's really striking. And so looking at the difference between the reach factors and we see the identified risk, there's just so many gaps, and that's an example that really stands out for me.
And I want to throw the same question over to you around what are the most striking findings of the report from your perspective?
Sure. So I would say, well, let me just back up a second too. I think something I want to circle back to is how we determine the risk level, because my answer kind of feeds into that. So we created sort of a risk score for every county based on those 16 indicators, basically by comparing each county relative to all the other counties. So a county that was doing poorly in relation to the other counties in Mississippi could be considered high risk. One that was doing very well related to other counties would be low risk. And then we had two kind of buckets in between, which were low to moderate risk and high to moderate risk. So I just want to make sure that that was clear. So I would say the pre-K collaborative program was a really interesting finding. And so it is a new program that's been growing since 2013. And currently we have pre-K collaboratives in 18 of Mississippi's 82 counties. So obviously we want more pre-K collaboratives. And when you have, I think maybe many of the counties in Mississippi are sort of in this high risk bucket, you're inevitably going to have some high risk counties with no pre-K. And so what we found is that of the 18 pre-K collaboratives, 3 of those were in high risk counties, 4 were in moderate to high risk counties, and 3 were in low risk counties, and 8 were in the low to moderate risk. And so really there's a big need to expand pre-K. And I think the point of the report is not necessarily to point out the weaknesses, but to say that, we have a real opportunity with state-funded pre-K in a lot of these high-risk counties who could potentially use that. And I know there's, a lot of things that go into selecting pre-K collaboratives. I think there's sort of a competitive application process, but that is certainly something, if you look at where there is a lot of risk and where there's reach, on one hand, there's not a lot of reach currently with the pre-K collaborative program yet, and there's still a lot of risk. So a lot of those high risk counties are not covered by pre-K collaborative.
In reviewing the report, one really could be left with a sense of hopelessness, given the high percentage, 75% of Mississippi's children live in the high risk to moderate risk counties, while 25% live in the low risk counties. So to each of you, what can be done in Mississippi to increase the number of children living in low risk counties while decreasing the number of children who live in high to moderate risk counties? Specifically, what are policies or programs that can be spotlighted that can help change outcomes for our children?
Sure. So you're exactly right. You can definitely have a sense of hopelessness when you look at the percentage of children living in high-risk counties. And at the same time, it is a way to really look and take, I think, a deeper dive on the importance of equity in funding, the importance of looking where the greatest needs are of children across the state. And when we think about being mentioned earlier about pre-K collaboratives, we know that less than 10% of Mississippi's 4-year-olds are being served in the collaboratives that are paid by state tax dollars. And so I think this points a pathway of where additional funds can go. And we need to take a look always to not only the equity in funding, but taking a look at disaggregating the data. When we think about policy and we think about states that are doing better by children's outcomes, one of the indicators that states have really taken on are having a state-based earned income tax credit for families who are working, but yet who are really struggling. They're making too much for much assistance, but again, there are opportunities to help decrease poverty, because we know poverty underscores so many of the negative outcomes of children in this state and across the country. So those are certainly a couple of the areas looking at additional funding needs for pre-K. I mentioned earlier about home visiting programs. And because we also know, even though this is risk and reach, we also know there's a resilience nature of people and children and families. And while they're struggling, parents want to do good by their children. Parents want to have a better life for their children. And I think the pandemic, as we mentioned earlier, has really stripped away a lot of the needs for families and children across the state. So these are, as Ben said, real opportunities. And again, we just want to kind of see this as a roadmap on where the state can go, where policymakers can take a look at this, where community leaders, where parents, teachers, anyone really who cares for and cares about children in this state.
I appreciate the opportunity framed, Linda. Ben, I'd ask you to dig in the same question.
Yeah, I'd second what Linda said, and on the topic of pre-K, just to acknowledge that there's actually been progress on that front over the years with increasing funding and more recently increasing the amount of funding that goes to the existing programs. And also, I don't know, Linda, if you wanted to say something about this, but I believe that the Children's Foundation sort of sponsored a survey that went out to the general population, and that's something that really we see widespread support for from the general population of Mississippi in terms of increasing and expanding pre-K in the state.
Sure. In two separate surveys done over a decade apart, 83% of Mississippians in a random survey, so that is obviously generalizable, for over a decade, 83% of Mississippians are supportive of funding for pre-K collaboratives. And as Ben said earlier, we know it's a program that's having great success. This past year, it's my understanding that the pre-K collaboratives, which is a collaborative of Head Start, childcare in some areas, and then pre-K within the schools, have met all of the near benchmarks, which is really exciting for Mississippi and for Mississippi students. And I think, again, I keep talking about COVID. It's such an underlying that we deal with every day. Now more than ever, the importance of quality care and education in pre-K, and having children having any concerns or any concerns on detecting developmental delays, helping really launch children and have them get off to a really good start is very important. So it's really the quality childcare before pre-K, and then pre-K programs as well.
We know that this report is one that the Children's Foundation is using to guide its work. Then what are other ways from a research perspective that findings from this report can be used? How can individuals find more specific information about their county, as an example?
So, well, we hope that all the a variety of stakeholders will use this to make data-driven decisions. And so that could be a diverse group of individuals. It could be legislators. It could be state agency heads. It could be philanthropies and nonprofits. So in the case of philanthropies, we would hope that they would look, for instance, in the education section or whatever sort of is their focus in their philanthropy, and look at, are these grant dollars going where they are most needed? And on that topic, just to pick on philanthropy for a moment, because that's something that we feature in the Risk and Reach report. So if you look at just the high-risk counties, the 14 high-risk counties, there was a total of $219,000 that went to elementary and secondary education in grants. And so if you look at the total share of grant dollars that went to education across the state, that's just 2.6% of all the grant dollars. So they tend to be concentrated in specific counties. And so that's just one example of something that maybe like a philanthropy could use to evaluate when they make their grant making decisions and their agendas. And then the sort of recipients of grants, like nonprofits, can use it when they're applying for grants. We often get data requests from nonprofits across the state asking for specific data sources to help us, establish the case for need in their county. And on the topic of county data, we should have at the, by the end of this week, county level fact sheets that will be released, which have all the risk data for each county across all 16 indicators. And just to, make a plug to some of the other resources that Kids Count already has. So we contribute to the Kids Count Data Center at datacenter.kidscount.org. And it has many of the indicators in the report, not all of them. Some of them you'll have to read the report to get or look at the county fact sheets when they come out this week. But I would say that, I think that's some ways that from a research perspective that they could be used. And I think those county fact sheets will be a good resource for people looking for information on their county.
Linda, what other ways will the Children's Foundation use this report in its current or future work?
Yes, I'm pleased to say that last week these were all distributed. Every Mississippi legislature has a copy of the Risk and Reach report on their desk. We would like to encourage the audience today to go to our website. It can be downloaded at childrensfoundationms.org, or you can simply send an email to info@childrensfoundationms.org requesting a hard copy of the report. And as Ben said, by the end of the week, we'll have county level fact sheets of the risk components, and for people to really start taking a look at their own county and have discussions. The Children's Foundation is also in the process of beginning to go into the county, at least virtually right now, and eventually in person, to talk with people at the grassroots level, to see what their needs are, to see how folks can collaborate. I heard something very sad last week. I was talking with another colleague, and they were asking about the Risk and Reach report. And so I was explaining some of the things we just talked about today. And this person said, "Oh, would you send us copies?" Because she had talked with two people earlier that day or the day before and said, "We are in such a small county population-wise. Sometimes we feel like that we've just been forgotten." And that was one of the things that just really spoke to me. It's like, no, you have not been forgotten. And most of all, the children in these counties, we want to lift them up. We want people to feel good about the potential that is out there for children. And we want individuals to really talk with decision makers and policymakers and let their voice be heard on how things can change in their county. And so while this is a summary and is pretty much factual and laid out, it also cues up what the Children's Foundation will be coming out with later this spring, early summer. It will be a blueprint for success for Mississippi's children. Initially, it will be looking at, and the Risk and Reach report will be one of the sources of information that we will use, along with a lot of other input that we've had and been collecting since late last spring or early summer, to really think about a blueprint for success for Mississippi's children. Initially, it'll be for children 0 through 8, and then after that, we'll be looking at older youth 9 through 18. So we see this back to sort of the GPS analogy as a guide for our work going forward.
Well, that is a perfect end to what has been a wonderful conversation, just lots of really rich information. You heard it, go out and get your Risk and Reach report. We're asking all of our stakeholders to do that. And many thanks to Ben Walker with Mississippi State University and Linda Southward with the Children's Foundation of Mississippi. I think about this sort of actionable knowledge. We have an opportunity to use this as a real tool to help us propel all of our children to success. And I want to thank you both for your time and all of the energy that you and your respective organizations are putting into work on behalf of our children.
Thank you. Thank you, Yumeka. We appreciate you.
Thanks.